Do you suffer from chronic fatigue? Do you suffer from insomnia? Do you suffer from muscle weakness? Do you suffer from an air hunger experience? Do you actually feel like you're not getting enough oxygen to your brain? In this video, I'm going to share with you exam findings from a patient who has experienced all of those things, who's been around this country and down to Mexico to try different procedures with doctors who've told him that it's only Lyme infection, who've told him that he's got mercury toxicity, and they've given him boatloads of antibiotics. He spent tens of thousands of dollars in Mexico actually to take boatloads of antibiotics. I mean, they, from what he told me through IVs, they just shoved it into his body every day for 3 months with no results. Heavy metal hair testing, heavy metal detoxification strategies, no results. And what these doctors have failed to be able to do is to diagnose where, in which tissue, in which cell is his body primarily having the malfunction. My test with him showed that the red blood cell, and actually let's be even more precise, the hemoglobin within his red blood cell was very sick, is very sick. Today is August 6th. I examined him August 4th of 2015. He'll be starting his protocol next week. And this man told me that he has told doctors for a pretty long time that he has, and I'm meaning for a few years now, that he feels like he's not getting oxygen up to his brain. I look at his red blood cell analysis, and the red blood cells look normal according to the laboratory range. His hemoglobin looks normal according to the laboratory range. Now the hemoglobin, one more time, is where the oxygen resides in the red blood cell. In this man's exam with me, with my kind of very unique bioresonance testing, very unique, I have samples of the red blood cell, sample of the hemoglobin. I can find if there is something wrong in that part of the cell, the hemoglobin, in any organ or system in your body, even when the blood lab says it's normal, even when the so-called specialist tells you that you're all normal and that it's all in your head and you can't be possibly experiencing the symptom that you say you're experiencing. So his primary tissue that came up on this exam on August 4th was his hemoglobin. And get ready for this long list, because what appeared in his hemoglobin, I'm going to count first. We had 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30 different infections and toxins inside his hemoglobin. Understand this, that the hemoglobin needs to have oxygen only inside there. Iron, oxygen. Well, oxygen is attached to the iron. It needs to have oxygen in there. All of our red blood cells need that oxygen. What happens if, let's say that there's supposed to be 50 molecules of oxygen within the red blood cell, in the hemoglobin, and let's say that somehow a parasite gets in there, or somehow a toxin, lead, or an antibiotic residue, or some other toxin like a food preservative or food additive actually gets inside that red blood cell and takes up the space where all of those 50 molecules of oxygen are supposed to reside. Now let's say instead of 50 molecules of oxygen reside there, let's say that there's only 10 molecules of oxygen. But for some reason, the blood laboratory says you're normal. Let's understand something briefly before I get into these findings, that the blood laboratory range may allow you to have a passing grade, like when you take a math test in school, your passing grade, lowest passing grade would be a 70, the highest would be a 100. Let's just say that the school had changed its lowest passing grade, its decision to allow who can pass and who fails. Let's say they dropped it down to a 65. Now a 65 would be like a mid-level D. So let's say that they let a 65 pass. So now more kids are passing, but they're not passing with a very good education, but they're able to pass and not fail. Parents are not upset. Kids graduate. School looks good for that part of the fact. But let's just say for you that your red blood cell test, your hemoglobin test, allows you to look like you're passing even though you really fail. It allows you to look like you have a passing grade, but your your body's requirements, your brain, your bone, your muscle, your heart, your thyroid, your liver, your kidneys, all of these different systems require your hemoglobin level and your red blood cell level to be more in the 90s, a 93 and 95, in order for you to be functioning at a very best of your potential. Not you just passing by with, let's say, a 70 average or a 69 average. But it looks to your specialist physician like you're passing, because on the blood lab next to the red blood cell, or RBC or HGB for hemoglobin, it doesn't show an L. It shows no mark, because you fit within the lab's range. But again, your body may require you to be above a 90%, not passing at a 70 or a 65. You understand that scenario? Your body's hemoglobin levels may need to be much higher than what the lab tells you is okay for a passing grade. So you need somebody like me with a very unique skill to be able to come in and examine you and find, is there something that's in that hemoglobin that's not allowing 50 molecules of oxygen? Let's just say that there's 50 molecules in there. That you don't have 50 molecules in there, you only have about 10 or 15 or let's say 20. But you've got other toxins and infections that have gotten in there that reside in that blood cell. So in that red blood cell, and there are millions of them, that go up to your brain to open up and let that oxygen get into your brain. Let's just say it doesn't let enough oxygen into your brain or your bone or your muscle, and it's also dumping out infections and toxins into that brain, bone, or muscle. Just imagine that. You're getting sicker, you can't get enough oxygen there, you can't thrive. You could feel literally like you're dying, like you're taking your last breath. I hear that from patients. I have such air hunger, they tell me. I have lightheadedness. I'm not dizzy, but I'm lightheaded. I don't have strength. Well, this man with anxiety, with brain fog, with muscle weakness, with insomnia, with fatigue, we finished one protocol, and when he came back to me on this visit, he said it was easier to get through his day now. He had 2 weeks of easy to fall asleep experience of just going right to bed and falling asleep. He woke up to go to the bathroom, came right back to bed, fell asleep, no problem. And now he said it feels like less of a hangover is what he's feeling. Well, let's get into his exam finding here. And it was pretty exciting for me and for him, because it was totally a wake-up call. And it was the man had expressed to me, which you'll get to meet him sometime when he's feeling a lot better and he's willing to get on camera. You will see who he is, but he definitely liked to party. He had some fun with friends and trying different kinds of drugs. And what we found, the first toxin in his hemoglobin, mushrooms. Psychedelic mushrooms showed up in his hemoglobin. There's a remedy made for that, and that psychedelic mushroom will get out of that hemoglobin, and it will allow oxygen to get in there. We found fluoroquinolone medications, dangerous antibiotic medication inside his hemoglobin, taking up space. I found the Lyme Borrelia burgdorferi infection inside the hemoglobin. That will get out with a particular specific remedy that will remove that. I found Ritalin inside his hemoglobin. He told me he has snorted some different drugs, and who knows if they cut up those drugs with some Ritalin pills. He never took Ritalin as a medication, but he knows that he's done things that made him feel very speedy. So Ritalin was also in the hemoglobin. The MSG chemical, neurotoxic substance called MSG, which you know, monosodium glutamate, a flavor enhancer in foods, in his hemoglobin. Residues of petroleum fuel in his hemoglobin. Recreational drugs in the hemoglobin. Multiple chemical substances like pesticides and herbicides in his hemoglobin. He had a very high level of psychedelic psychotropic drugs in there. You know, we're talking about things like LSD and ecstasy, parking their space inside the hemoglobin where the oxygen is supposed to exist, causing him to feel weak, causing him to feel no energy, insomnia, muscle weakness, air hunger, lightheaded. He had heavy metals like lead and arsenic in there. He has alcohol inside his hemoglobin. He had a virus called rotavirus, I'll put that on the screen, inside his hemoglobin. He has cannabis, indica, marijuana inside the hemoglobin. He has E. coli, bacteria inside his hemoglobin, chlamydia inside the hemoglobin, the vaccine MMR, measles, measles, mumps, and rubella vaccine side effects of that inside the hemoglobin, Coxsackie virus, the Coxsackie virus inside his hemoglobin, the Epstein-Barr virus inside his hemoglobin. Folks, it's never just one thing. So running a laboratory, let me stop before I continue with the rest of the findings. When your doctor runs a blood test and finds out there's Epstein-Barr virus, okay, there's Epstein-Barr virus. Where is the Epstein-Barr virus? Is it in one tissue? Is it in 60 different tissues? And it's in 60 different tissues? In what amounts in those 60 different tissues is that Epstein-Barr virus? He had mycoplasma bacterial infection inside his red blood cell, inside the hemoglobin. Toxic mold inside that same place. Tobacco smoke at a very high level inside that hemoglobin. Acetaldehyde, another toxic poisonous chemical that you can just get from in the air or maybe even in the water inside his hemoglobin. Dental amalgam, he had mercury removed from his teeth, silver fillings, also known as mercury fillings, removed from his teeth years ago. I think you said about 3 years ago, if I'm correct there. He has dental amalgam inside his blood cell. He has a mercury dimethyl methyl chloride chemical inside his hemoglobin, taking up space. He has the side effects of and residues of the DPT vaccine, the diphtheria pertussis tetanus vaccine, inside his hemoglobin, taking up space, damaging that cell, not allowing enough oxygen to get in there to feed the brain and feed the bone and feed the heart and feed all of his organs and glands and all his muscles. He has residues of Avalox. We're talking about dangerous, seriously dangerous antibiotics. Whether he was prescribed the Avalox or they fed that Avalox fluoroquinolone antibiotic medication to a cow or to a chicken or to a pig, and he ate the meat, and then he absorbed that dangerous, deadly antibiotic. Look that up online, fluoroquinolones. I'll put that name on the TV screen here, on the computer screen. Tetracycline medication inside the red blood cell in the hemoglobin, and the varicella virus inside the hemoglobin. When you have any one of you has these, even if it's just one of these toxins or infections, let alone 30 of them inside your hemoglobin, there is no way that you can function normally. There's no way you can function strong. It is physiologically impossible for you to function at what you expect to function. And you can go to your specialist, who you call a specialist, whether it's a neurologist, a rheumatologist, or a general physician, or the best doctor in one of the biggest hospitals with the best reputation for being the best hospital in town, and they run a blood test, and guess what? They're going to tell you, we don't find anything wrong because your red blood cell looks normal. It's normal. There's nothing wrong there. When we find with this kind of testing that you have one or more, like these 30 toxins and infections inside your blood cell, it is impossible for you to function normal. I know I said that before, I'm saying it again. It is impossible. We have to clean this up. He is getting specific remedies for each one of these findings. These remedies are exact duplicate copies of these findings. And he's going to be taking each remedy in a specific design protocol for him over the next month. He'll be following a specific protocol that's very gentle, but very direct, very specific, to remove these toxins and infections from his hemoglobin, not from his brain or from his thyroid gland or from his parathyroid. It's coming out of the blood cell itself. Because you can clean up your brain or your thyroid, let's say, or you take some detox strategies for your liver or your intestines, but you've got infections inside your blood cell. That blood cell is going to keep opening and dumping these infections and toxins into any organ you think or you thought you cleaned up. You understand? Let's get down to the roots. Let's roll up our sleeves and get down to business and clean up your tissue. It can be done. Even if you have tried all the different doctors with all the different kinds of practices and you're still suffering, I have a very unique set of skills to find these infections and toxins in these tissues in the red blood cell itself and help you clean it up without using any other medications. You can get your life back. I'm Dr. Lonnie Herman. Come on and subscribe on my YouTube channel. I'll put that address here at the bottom of the screen. Come over to my Facebook page, like that page. I share information on a regular basis. And subscribe, subscribe to the YouTube channel, but share this video, excuse me, that's what I meant to say. Share this video with just one friend. Share this video because you can help someone, whether it's a headache, a migraine that they don't have answers for, muscle fatigue, muscle weakness, bone disease, cancer. When there is not enough oxygen within the blood cell, you can develop cancer. You get it? Let's take this seriously. Let's get down to the root of your problem. Allow me to help you. You can get well. And I'm looking forward to helping you. Call my office, 954-370-3100. Get ready to get your life back. Let's get started. Thank you.